It's so nice to see you. Well, welcome to everybody in the flesh, and also hello to everybody watching on the live stream at home. We know there's quite a few of you, so welcome. A free health service is a triumphant example of the superiority of collective action and public initiative applied to a segment of society where commercial principles are seen at their worst. And it is as well to keep in mind that a public undertaking of this magnitude is big business. It touches trade and industry at 100 sensitive points.
As we all know, the NHS that Bevan conceived in the 1940s is under threat, and unfortunately for too long, too many have taken it for granted. Too many of us are too young to know what it was like before. It was like the NHS that we now know. And unfortunately, like too many people are now indifferent to this.
And there are a lot of people working very hard to find their ways into this multi-billion-pound business and extract their own income streams. They work really hard to demonstrate that the NHS is inefficient and wasteful. They work hard to make you think that your hip replacement would be better and faster if you paid for it.
They work hard at undermining the NHS as an old-fashioned socialist dream that needs to be replaced with a alleged slick, efficient private enterprise. They work hard and they may be winning.
And now, what a great time and place to welcome to the stage the amazing Dr. Bob Gill. Dr. Bob Gill is a GP in Sidcup. He's also made the documentary The Great NHS Heist. So without further ado, Dr. Bob Gill.
Thank you for that introduction and inviting me to speak. I'm not a performer by profession, and public speaking was a barrier for me to start getting active, to be honest, a few years ago, nearly 10 years ago. I'm a GP. I look after myself and another doctor, 5,000 patients. And it's through that experience that led me to tap into the anger about what was happening to patient services and start to speak out myself. A lot of what has happened to the NHS has been done under secrecy. It's been very complicated, and it's required consecutive governments to be on board with the plan. And I'm afraid we are now entering the final stage of the privatisation. You may not be aware, but before Parliament as we speak, there is a health and care bill which will in fact make legal what has been happening behind the scenes for over a decade. We have private multinational corporations today running the NHS, but they wear a NHS badge. I'll give you one name, Mr. Simon Stevens. Mr. Simon Stevens, the Chief Executive of NHS England, has just been elevated to the Lords, where he is in a prime position to drive through this legislation. But where did Mr. Simon Stevens come from? Well, he was a manager in the NHS in the late 90s. He was an advisor to Tony Blair on health policy. He promoted Private Finance Initiative, which is a debt millstone on the NHS. He promoted the creation of NHS Trusts, which turns hospitals into standalone business entities. In 2004, he took a job for United Health. United Health is America's biggest private health insurer. He spent a decade at United Health, and when he left, he had risen to the position of President for Global Expansion for a private insurer, at which point he was hired as Chief Executive of the NHS. Alarm bells should be ringing for everybody. So an insurance man is put in charge of the NHS, and he brings forward two plans, the 5-year forward view and the NHS long-term plan. But many of these documents have a forward which sounds great, paying homage to the principles of the NHS, quoting from Bevan, but if you stay awake and read further, it's written in very dry management speak. It never mentions privatisation. But if you understand how successive policy works, you can read between the lines. And it spells out how the NHS will just be completely turned into a corporate cash cow. And what the bill does, currently before Parliament, will hand control of NHS budgets to American private insurance. The control of the budgets is being outsourced. The NHS is being broken up into 42 integrated care systems. Sounds great, integrated care. Who could argue with that? But what is hidden behind that label is the American managed care system, devised back in the 70s, revealed for what it is by the Watergate tapes, where Nixon was speaking to his advisor, where he described the business model. And it boils down to this: the less care you give, the more money you make. So the budgets are being handed over to corporations whose business model is to deny you care. What could go wrong? Now, the NHS I am defending is not the NHS in its current state. The NHS in its current state is not functioning very well. People are waiting hours to get treatment in A&Es. A&Es are overstretched. Ambulances can't drop patients off to get treatment. And they are tied up waiting in car parks, not able to get the next patient. The Royal College of Emergency Medicine estimated in the last year over 4,500 patients died as a consequence of overstretched A&Es. So they couldn't offload the patient wasn't getting treatment in the back of the ambulance, and patients were dying at home waiting for an ambulance. That's in the last year. That's on top of COVID. Why did it end up like this? Because in the last decade, we've lost 100 A&E departments. We've cut 20,000 beds. All the while, this is not saving money, because there has been a massive investment in the infrastructure required to deliver the dystopian, American insurance-led model that we are going to. In fact, the model we're going to will be more expensive, not less expensive. It will be more expensive. It will deliver worse care. So all the talk about efficiency is coming from people who are making it less efficient. There is an army of people within the NHS who have no medical skills. They're managers, they're accountants, they're management consultants, they're chief executives. What you have within the NHS is a leadership totally disconnected from the people delivering the care. And that's necessary, because if they saw the effect of what they were doing on the front line, if they had a conscience, if they had a soul, if they weren't sociopathic, they couldn't carry on doing what they are doing to the rest of us. So that's where we are. I was given some passages from Bevan, and we've heard a lot from Bevan, but this is very powerful, because all the arguments he made at the beginning of the NHS stand firm now. This is not based on some religious belief. It's based on hard fact that the best way to organise a health service in any country is for the state to fund it and make the people delivering it employees of the state. It's the most efficient way to run a health service, and you remove the financial interest out of that relationship with the patient. Now, it's not something I gave a lot of thought before I became active in campaigning and realised what was going on. But can you imagine the tension created if the person in front of you couldn't afford your services, had to pay, or delayed coming because they were worried about paying? Now, we've seen the effect that the pandemic's had on some of my patients who thought, well, I don't want to bother the doctor, He's too busy. I'll wait. And unfortunately, a chap who I'm seeing recently put off coming to see me with his chronic cough for 6 months. And now he has widespread metastatic carcinoma of the lung, which is spread to his brain, his liver, and his bones. Now, he did that off his own back. But we know that services have been overstretched and people haven't been able to get in. Now, we heard about the clapping for the NHS. But what the government's actually done is set up the GP services to be scapegoated. And we've seen this play out in the right-wing press recently. You've not been able to get a face-to-face appointment, despite GP services never being more overstretched than they are now. So the point I'm making is the cynicism, the deception of our political class is beyond description, in fact. They can clap for 1 minute whilst they're using the cover of the coronavirus to push through legislation which will totally devastate the services that you'll be able to access. So I just want to read one passage from Bevan. The health service is being launched in stormy waters, but then the launching of any big ship causes considerable water displacement. It is hopeless to expect such a service to be started without controversy. It will be a very great revolution. It is being watched by every country in the world. They will come over here in stream of visitors to find out how it works and how its difficulties will be resolved. We shall, of course, from time to time have alterations and adjustments will have to be made. We are not ridden by doctrine. We are a nation largely of visionary empiricists, able to adjust things where necessary, and between us we shall have a standard of health service that will be the envy and admiration of the world. And he was right. Our system, the beverage system brought in by Bevan, was copied around the world. In Israel, in Scandinavia, in Spain, in Italy, in Saudi Arabia. Because they realized there is no more efficient way of doing things. It can't be done. There is no health service in the world that is privately delivered, which looks after everyone. Privatized medicine avoids sick people because they're expensive. The business model is not to spend the money on the sick. You couldn't make it up, right? So we are copying the most expensive, one of the worst performing systems, which is endemically fraudulent. An estimate of 10% of US healthcare cost goes in fraud, double billing and all the rest of it. So it takes a certain type of person to knowingly do this to the nation. I hope you'd agree. And, nobody in this room fits that description. Another bit from Bevan. We regard it as being inconsistent with a civilized community that, with a reasonable health service for patients to be bought and sold over their heads. When I am told that all they desire is that patients should have the best medical treatment, how can that be argued when doctors succeed another doctor's panel not on account of personal qualifications, but on the size of his purse? How can it be reasonably be argued that there is any effective free choice of doctors when the doctors negotiate the terms between themselves and the patient knows nothing at all about it? Now, he's describing a situation where you had a medical establishment potentially threatening the establishment of the NHS, but also running a system whereby, again, they avoided sick people and they avoided poor people. You had a concentration of health services in the rich suburbs, and you may get the odd doctor doing a bit of charity work for the poor. That's how the system worked. The only difference now is the doctors won't have the decision-making power either. That's been taken away from them to the managers and the insurers. So the power has shifted, but the business principle remains the same. And that's why I think meetings like this are important, so that we can get this message across that the population, the vast majority of the population support the NHS, but they are hoodwinked into believing that somehow it can't carry on, it's unaffordable, people are living too long, there's too many immigrants. I can name you one false narrative after the other and knock it down. But I'll bring it back to you guys now. Thank you.
We've just got a couple of minutes for any questions. If you're at home and you just shout really loudly, we might be able to hear you. But yes.
Bob, is this reversible?
Yeah, so anything is reversible if there is a political will. The question is, how do we create that political will? So we need a critical mass of informed, engaged and brave people to push back. Let's not forget the NHS didn't form because the ruling classes wanted to gift us a health service. They were fearful of these armed people returning from war, not happy with what they were given. So there was a public pressure and a fear amongst the political class, I think, that gave way to the NHS in the first place. We need to clarify our message, clarify our call, generate a massive public pushback. And it is reversible, yeah? They pass another law and we renationalise the NHS.
The problem being, we don't have a media.
Yeah.
It's gagged.
I'm not saying it's going to be easy, but we have to try.
We have a question down here. Hi, Vanessa.
Yes, sorry. Thank you so much for your work and for what you've told us. We don't have an opposition, a political opposition in this country. That's where we need to, I feel, we've got to do something about that. We're sunk, and the NHS, as you've explained, to move this, we've got to get to the people who vote Labour. Or maybe they won't listen, but I think they would. But we've got to be unafraid, and you seem to be wonderfully both informed and unafraid. I'm sure there's a lot of people our age who would come and speak behind you and do anything we can to give the support so that you can get the hearing of these Labour constituencies. But I think somebody's going to try and stop you. And that's going to be Keir Starmer and a few others. But this is what we need. We can't get the mass because the Labour Party is standing in the way.
So there we go. We need you to run for leader of the opposition.
Could you reply?
Yeah, would you like to reply to
Yeah,
that?
I agree with you. We wouldn't be in this mess if we had an effective opposition. I listened very closely to the Labour Party speeches by Keir Starmer and John Ashworth in the recent conference in Brighton. Not a word about this. There is no excuse now. We know, we have all the evidence that this direction of travel is catastrophic. It's down to privatisation and the lack of bed capacity that we had an estimated 100,000 excess deaths due to the pandemic. We know it doesn't work. We know the NHS was crippled by all these changes that have taken place over the years. So the ideology, the self-delusion that somehow this will improve care, held by any Labour MP in a position of power now, should have been totally shattered. There was no excuse for them to have a wake-up moment and do the right thing, but they haven't done the right thing. So we need to pressure them, absolutely.
And I'm sure you will say how much more. My local health centre, where there's a little group of GPs who are there all the time, all the people behind the perspex glass say they could do so much, and they're paid, they could do so much more to help, but they're not allowed to.
Yeah. So along with the marketisation and the privatisation, it has sucked up a lot of resource. So a lot of my time, I have two managers just to deal with the bureaucracy of the privatised NHS. if you go to hospital and the consultant sees you and decides you need to see a colleague, you have to come back to the GP. It used to be beautiful where they could cross-refer. You might have even got you seen the same day, just say go down the corridor and see my colleague in the chest clinic, come out of the heart clinic. As a doctor working in hospitals in the early 90s, we used to do this all the time. But they've introduced barriers to the streamlined functioning of the NHS. They've made it extremely hard for us to function efficiently. Not only do you have to care for the patient, you have to write reams of documentation, and the discharge letters we get from the hospitals are not overwhelmed with medical detail, looks more like an invoice. It tells you what you've had done, doesn't even tell you the result. It lists, itemized what you've had done.
Like
So-
a bill.
Like a bill. So it will just take one switch of the computer program to switch it into a bill. We're not far off.
I was wondering if you could tell us a bit about your documentary, both what it's about and also where people can find it, because I think it's available online, isn't it?
Yeah, so we made a film exposing all of this 30-year program, hopefully in a understandable manner, and the response you should have after it is extreme rage. That's why we made it. It was not designed to appeal to your emotional and human instincts. It was designed to make the rational, economic, societal argument for not copying the worst system in the world. It's available on YouTube. It's called The Great NHS Heist. Please watch it. Please inform yourselves. We can all engage, right? We have limited opportunities, but we can all pick up the phone and ring a national radio station when they have call-ins to counter the propaganda that we are being immersed in, yeah? We can spread the word amongst our friends, our colleagues, our family. We can all do that, and that will amplify the awareness to just about what we're on the brink of losing.
Thank you, Dr. Gill. And I was just kind of building on what you were saying. We're children of blood. We're children of blood. Tony Blair's not my dad, but we are children of blood. Thankfully. I was wondering if you might be able to just offer some reflections on how the NHS has changed since New Labour came into power and up to where we are, and including how we've dealt with COVID.
How long have you got?
About 5 minutes.
What has happened is, because particularly in the last decade with austerity, the time you have to do a good job is extremely limited, particularly in the hospitals, in the acute specialities for acute medicine and surgery and A&E. You cannot do a good job, right? So you have to rush people out. There aren't enough beds, so you have to discharge people when they're not ready, and they often end up bouncing back in. And what that does on a human level to the staff, we had these beautiful poems being read out, it destroys something in you, yeah? So you are having to accept giving second-rate care. And that's being normalized because you can't offer anything else. Now, either it destroys a bit of your soul day by day, having to do inferior care, or you leave. Or even worse, you become hardened and you no longer recognize it as inferior care. And that is the biggest problem. So I have actively avoided jumping into the pitfalls created by government. They do things by carrot and stick. And for GPs, they've offered these poison-laced carrots to do things that actually destroy continuity of care and fragment the GP care. And even though it's meant a financial loss to the practice, I've refused to do it because I've seen where this is going to end up. I never closed down my surgery for one day throughout the pandemic. We took mitigation and I carried on seeing people. And we've maintained continuity of care. Now, if you do that, you're not going to get overrun. But as soon as you fragment care, it generates more work, dissatisfied patient, dissatisfied doctor, loss of that learning, because we're all learning all the time. Well, if you don't follow people up, you're not going to learn. You're not going to become a good doctor. You're not going to learn from your good decisions and your bad decisions, yeah? Mm-hmm. So the system now is introducing more and more disconnect between the caregiver and the patient, and that's not good for anybody. The one thing we must remember is that the doctors, nurses, all the healthcare professionals, and the patients share the same interest. Who wants to give bad care? Who wants to work in an under-resourced hospital? None of us. Who wants to be paid badly? Who wants to be seeing a doctor or nurse who's overstretched and on the point of burnout? That's not safe for you guys, right? So we have to join together against the people who are doing this to us. Our interests are totally aligned.
I think we've got time for one final question. We've got a hand at the back. Yeah.
Yeah, you were saying about the measures that they're pushing through under the cover of COVID. I just wonder what your view was on vaccine passports that they're trying to make mandatory.
Yeah, so again, common political strategy is to use any crisis for pre-planned political objectives, and we've known that Julian Assange and Snowden revealed that this country had the world's biggest secret mass surveillance program. Now, if you look at the logic behind an electronic vaccine passport, well, if you're vaccinated, good luck, you're not going to get seriously ill, that's the evidence. But you can still get infected, and you can still pass it on, right? So then where is the logical basis for an electronic passport? There isn't one. But it only starts to make sense when you realize what else is down the line. I won't go into too much of it, but what else is down the line is to get rid of paper money and put your all financial transactions on your phone, and it's a mechanism of control. So again, their ruthless cynicism is using the pandemic to scare people into adopting a technology which will be used potentially as another mechanism of control.
I'll go on. I can't resist.
Just a quickie.
Yeah.
2 or 3 things. First of all, the 5-year plan, what it says first, digital care first. So the digital is above seeing a doctor, everything. You've seen a human being, the doctor to see you. So digital care first is what the DHS of the NHS England, the bill says. Digital care first. So I think it's important. Secondly, what Vanessa said, the Greenwich campaign group spoke to the council a month ago, but the council leader, who is the head of all London Health in the GLA, believes this is marvellous. They won't allow you to say anything against it, and in fact a lot of the councillors say it's political. And I've actually been heard the health scrutiny person, who we've had good relationships, has actually said we can't talk about that, it's political. Another councillor said that's to do with Parliament. So it looks as if they're being squashed even further by Starmer, not to upset things. I don't know who's saying it, but I've never heard it before.
Yeah, so part of our role is to not only educate each other, but educate our political leaders, local councillors, be whoever. Yeah.
I'm sure Bevan said it, but Bevan said public has provided, and that's an important part, because if you look at social care, people don't understand. Social care is run 99% by private companies. It was deregulated in the 80s and started there. So therefore, they cannot give care and make a profit. So all this thing about how much is going into the social care, they can't, unless they give it to the private companies, it's in a mess. So that's look at social services, and that's exactly what's going to happen to us. Look at your dentistry, that's what happened to us. So that's just a few things. I hope Bob doesn't mind.
Thank you so much. Bob, would you like to briefly respond?
No, I think they're all valid. I know Francis, we've been campaigning for years together, and she always reminds me of the things I've left out. So that's good. And so the take-home message is this is not some theoretical threat 10 years in the future. It's very imminent. And, I've also been supporting a group called Your NHS Needs You. If you go to their website, yournhsneedsyou.com, they're currently running a campaign to tell the peers to put as many obstacles in the way of this bill as possible. So if you could all do that, that would be great as well.
And what is the name of the bill?
It's the Health and Care Bill.
I have a question over here. Go on, Bob.
I was just going to ask Dr. Gill. You've spoken about a critical mass and the need for that, and we've got a wonderful audience here today. We've got a wonderful audience online as well. What are the kind of tangible takeaway things that we can do tonight, tomorrow morning to fight for our NHS?
get informed. So there's a book called The Plot Against the NHS, which is about 150 pages, very readable. It will give you the background. Watch the film, The Great NHS Heist. Again, the edit is only an hour and a half, and you'll know more than most politicians at the end of that. And join, engage in social media, engage in any opportunity to interact. As I said, radio stations are quite an easy one. And inform your network, because the only way we're going to get a critical mass of informed people is to inform them, right? So that's where we need to start. And that's where the media has been so effective in silencing public awareness. Why isn't this on the BBC tonight?
Yes, why?
What more important issue is there than the health of the nation? But just one example, Channel 4 about a month ago did a hit piece on the NHS called Clapped Out was the title. It was an hour-long documentary. Great footage, must have cost a couple of £100,000 to make. But the end result, the message you took home was, we simply can't carry on with this current system, and we have to look to a European model, which is the deceptive diversion. There are no European companies that I know of that are active behind the scenes. They're all American. McKinsey, PricewaterhouseCoopers, these international companies, United Health and Centene. They're American. Simon Stevens, educated in the American industry. The threat is America, but they don't want you to know that, because we have a feeling that it's really bad over there. So every time you have the opportunity, you tell people we are copying the American system, join us to fight to stop it.
Thank you. Thank you so much, and just a reminder as well. The poetry book both downstairs or if you're online through the website, and a huge thank you to Sands Film Studios who put this all together and have done an amazing job in compiling the performers who were all brilliant, and the poets who were all brilliant too.
Absolutely, and we just kind of encourage you to go, inform, educate, agitate, organise, spread the word to fight for the NHS and to keep it alive.
And a reminder as well that you can watch a recording of this online after the event has ended. It will be available indefinitely, so you can re-watch our shiny faces.
And well done to Matt and Helen.
Oh.
Have a safe journey home. Thank you so much, everybody.